Welcome to episode 3 of our podcast. I am Dr. Elena McDonald, board-certified general pediatrician, and I am Dr. Delina Wardlaw, board-certified family medicine physician. And together, we are the Twin Sister Docs, and collectively, we have 50 years of experience in practicing medicine. Our goal of this podcast is to help you navigate which can oftentimes be a complex medical system, and also to help you live your healthiest, best life. Today, we are going to address trusted resources. Oh, let's get into it, Dr. McDonald. Let's get into it. When you say trusted resources, what do you mean? When people get their information, oftentimes the information is not accurate, and oftentimes it's completely false. So we tell anyone we're speaking with, one, check your resource. Where did the information come from? And once you get the information, please feel free to check in with us to clarify if this information is correct or not. Now, when Dr. McDonald says check in with us, she means actually check in with your doctor. Yes. Check in with your physician. We tell our patients to check in with us directly. We want you to check in with your physician directly. And oftentimes you will hear Dr. Wardlaw and I say, who are they? And what do we mean when we say that, Dr. Wardlaw? Where did you get the information from? What is the source? Is it a reliable source? Was it a source that came from anywhere? Did it come through a text message? Did it come from social media? Did it come from your doctor? Did it come from the CDC? What is your source and how reliable is the source? So we have family members, friends, they may be providing with information that they think is correct, but it is not correct. So you always want to double check the information that you are receiving before you act on it. In the day of social media, there are plenty of people giving out medical information on the internet. You have to actually vet that information. You have to actually make sure that information is correct. Now, we do know that, just as Dr. McDonald and I, we're here, we're doing a podcast, we're giving out information. You don't know us personally, you too need to check with your doctor also to make sure that the information that we're given, could it pertain to you? Does it not pertain to you? Again, we provide accurate information as trained physicians, as scientists, but you need to talk to your doctor to find out what exactly affects you. Right. And this is general information that we are providing. This is not for any particular person. Any information you receive from the Twin Sister Docs, you want to use that information to have a conversation with your own personal physician. Absolutely. So yes, please know who they is, and please know what the credentials of they is, and make sure that you are aware of who they are and how that information can be utilized. Right, because misinformation, to be quite honest, can be very harmful, and it can be detrimental to individuals. So please double check the information that you're receiving. We've seen misinformation run rampant on many of occasions, and we all know that we've just come out of the COVID pandemic. And we know that misinformation was rampant, a dime a dozen. Unfortunately, it's still rampant. It has calmed down some, but we still have instances where misinformation is still being spread around. There was actually a text message that was spread about a COVID variant that is no longer even in existence. There was information in the text message saying that the COVID variant was more deadlier and it couldn't be detected through the home COVID tests, and that it didn't have the usual symptoms that usually present. Totally false. But Dr. McDonald and I got that information from multiple people that we knew in different circles, whether or not they were on, family and friends, whether or not went to school with our children, or sports teams with our children, patients. We were receiving that information from everyone. So we just ask that when you give that information, one, try not to just forward it without knowing if it's actually true or not. Two, check the source. That text message that was going around saying that this is a new CDC advisory, I just implore you to very simply go to your phone, go to the CDC website, and see if that information can be confirmed and or verified. Making sure that, again, we're not taking part of the train of passing on misinformation. Exactly. And so, trusted information, trusted messengers. Dr. McDonald and I, we pride ourselves on providing information to the community provide ourselves on making sure that we are not only explaining information, but also making sure that people can gather information they can take back to their own physicians.
Yes. So when we say who is they, that's exactly what we want to know. And when we find out who they is, we want to know what information you received. Because if it's really not credible, we're glad that you brought it to, we're glad our patients bring it to us. We hope that you would take it to your doctor so that we could confirm or let you know that this is not the correct information.
Yeah. As Dr. McDonald said, sometimes information is correct. And so, yes, we will verify that for you as well. But yeah, so that's where we are with the.
Yes. Be very cautious of information that you are receiving, whether or not it's text, especially on social media. You want to make sure it's correct.
Absolutely. And we'll give another instance that just happened outside of medicine. But this is how things, can morph into bigger situations and morph into toilet paper shortages, just like we had during COVID. Like we had during COVID. We had toilet paper shortages a couple of weeks ago. The dock workers were discussing their strike, and then there was a text message that started running rampant about make sure you get your toilet paper, make sure you get your dish detergent, make sure you get your toothpaste, deodorant. I mean, that, and again, I received that text from multiple people, from family members, from friends, from colleagues. And so again, just wanting to just put a pause and just making sure that we're not adding to unnecessary frenzies.
Yes.
I agree 1000%, Dr. Wardlaw. Absolutely. I tell my patients, make sure that it is a known medical source, the Mayo Clinic, the Cleveland Clinic, the CDC, making sure that the NIH, these are reputable places. John Hopkins University.
Yes.
Temple University. Our great centers here in
University of Pennsylvania. Jefferson.
Absolutely. So make sure that it is coming from a credible source. Make sure that it's coming from a credible source.
Because the reality of it is that you could trust the source that it's coming from, but it may be inaccurate. So you want to make sure that it is credible, as Dr. Wardlaw said. As much as your family has your best interest at heart, the information may not be correct.
Absolutely. So there we are.
Trusted resource. Please know the resources, because as Dr. Wardlaw and I will always say, who are they?
Well, with that, let's jump into a discussion, Dr. McDonald, which really became magnified during the COVID pandemic. And receiving accurate information from trusted resources really became pertinent for people, particularly during the COVID pandemic and the COVID vaccine program.
Yes. So in general, vaccine awareness and vaccine education. We know vaccines are extremely, extremely important in helping to prevent the spread of diseases that can lead to severe complications and sometimes even death.
So we've been giving out vaccines for well over a century.
Yes.
And we do know that, vaccines, there are some vaccines that have been around for many years.
The polio vaccine,
chickenpox,
measles, mumps, and rubella, hepatitis B, pneumococcus,
diphtheria, tetanus, pertussis, also known as whooping cough,
HPV, human papillomavirus,
meningitis.
Yes. So vaccines have been out for at least 100 years. Some are newer than others. But it's important for people to realize when we talk about vaccines, Dr. Wardlaw, vaccines are tried and true. We have seen them work whether or not people recognize it or not. Vaccines have to go through a rigorous clinical trial before they are released to the market to be given to individuals. Vaccines have to be proved to be safe and effective. The benefit of the vaccine must outweigh the risk.
Absolutely.
And as we tell individuals, there's a risk of taking anything.
Mm-hmm.
A vaccine, an antibiotic, Motrin, or Tylenol. There's a risk for all of these things. And during clinical trials, all of those risks must be reported. But we always like to talk in terms of what is the actual potential of it happening and the likelihood of that it will actually happen.
Absolutely.
So when we look at those things, if the vaccine, if the risk is outweighing the benefit, we should not be talking to you about vaccines. Your doctor should not be talking to you about a medication where it's more riskier than beneficial to you.
Absolutely. And that's with anything. That's any medication. That's with any treatment plan. That's with any procedure. If the doctor's recommending that you're going to have a surgery, if there's a risk of you not being able to survive the surgery because you may have, your heart may not be working as well as it should, or your lungs may not be working as well as it should, or you're in kidney failure. Like, so you can have side effects or from multiple things and on multiple layers when it comes to medications. But again, with vaccines, we've seen it work in so many positive ways. Polio, we don't see smallpox. We don't see these conditions in the United States anymore. Even varicella.
Yes.
And as you always say, Dr. McDonald,
when is the last time you've seen a case of true varicella, also known as chickenpox?
Absolutely. Now, we do see reactivation of the chickenpox years later, also known as shingles.
Yes.
But as Dr. McDonald's talking about, Dr. McDonald's is talking about the precursor to shingles, which is chickenpox. So now we don't see that. We rarely see a case of chickenpox now. We do see shingles manifest many years later after chickenpox, after the individual has had chickenpox. But we do know that the chickenpox vaccine, very effective.
Yes. And I always tell people, why do you think we no longer see these cases of chickenpox? And it's because of the vaccine program. Even cases of measles, mumps, and rubella. We don't see cases of measles as much anymore. However, we do see cases where we have communities who opt not to get vaccinated, or if we have individuals who come in from different countries who are not vaccinated, and then they bring the disease in. And we saw that with COVID. But we have a vaccine that is very effective with protecting people from measles. We had a measles outbreak in Philadelphia in early 2024, late 2023, early 2024. So these diseases still exist. However, our vaccine program helps us combat these diseases very effectively. And as I always tell people, literally, we're at war, and the vaccines help us.
So can you explain what the job of the vaccines? What's the job? What do the vaccines do?
So the job of the vaccine is to the vaccine is created in a lab. The job of the vaccine is to actually show your immune system what a disease looks like without you actually having the disease. Your immune system now can develop a defense because it sees the blueprint for that actual disease. Fast forward 5-10 years later, you're exposed to that disease. Your immune system says, I've seen this. I have a defense known as antibodies, and I'm ready to fight this disease off. So individuals who get vaccines oftentimes will not get extremely sick, and they will not die.
For instance, if I'm going to play an opposing team, say I'm going to play an opposing basketball team, if I have their playbook, then yes, they'll come, they'll show up to the game, they'll suit up, they'll get on the court, but they're going to be less likely to be successful at making shots because I already know what their plan is. And so I already have a defense in place so that I can shut them down and prevent them from being even anywhere successful at winning that game. So the vaccine provides a playbook,
yes,
so that you can be prepared when the opposing team shows up.
Yes. And the vaccine, our immune systems work off of a memory. So once we see it, we can develop those antibodies in order to protect us from these deadly diseases when we actually see the true disease. So vaccines are extremely important for that very reason. We start to vaccinate as early as birth.
Mm-hmm.
So, and we vaccinate quickly because we want to make sure that we are building the immune systems of our children as quickly and as efficiently as possible to protect them from these deadly diseases. And there's only vaccines for certain diseases. There is less than 20 vaccinations out there for certain diseases. The majority of things we treat as they come along, but there are certain things we just don't need you to get because we've seen the devastating impact of these actual diseases.
And if you do get it, it'll be a much milder case.
Yeah.
A much milder case. And so we know with the flu shot, the flu changes every year. So hence there's a new flu vaccine every year. And so we are quickly realizing that is just likely going to be the same situation with COVID, because COVID changes its face and mutates often. Then we often need a vaccine to be able to defend against the new variants, the new mutations, the new changes that the COVID virus is so able and readily able to do, as it's able to change its face.
Yes.
Now, Dr. McDonald, when the COVID vaccine came to light, there were many concerns that this vaccine was made too quick.
Yes.
Well, we know that as time progresses, we know that with technology and new innovations that, it shouldn't be taking us nowhere nearly as long as it takes us to make a vaccine that was made 20 years ago.
Yes.
Or 30 years ago.
What people also have to realize is during the COVID pandemic, the entire world was being impacted by the COVID pandemic. So everyone was pulling together their resources. The government was funding the pharmaceutical companies to make sure that they could put all their efforts in finding developing a vaccine against COVID. So just as technology has gotten quicker with producing cars, it's gotten quicker with producing cell phones and iPads, the technology for producing vaccines has advanced also. But again, the whole world was focused on getting the vaccine. So that is why it was okay for us to get the COVID vaccine.
And we can see that we've come out of the pandemic. We are able to go back to school. We're not in a shutdown anymore. We're able to go back to our jobs, go to the grocery stores. Remember, we had to go to the grocery store. You had to have lines outside the grocery store.
Yes.
I couldn't believe it.
We could go to our children's sports. We could go see our ghetto Eagles. We can go see our Sixers. We can go see our Flyers and our Fighting Phils. We were not able to do those things. Our children were not able to go to school. And school is so important in the daily lives of our children. So we lost so many things during the pandemic, but it was the vaccine that helped us get to the other side of the pandemic.
Absolutely. It allowed us to be able to get back to normalcy in our lives. And again, I know that some people have COVID vaccine fatigue. However, if people can wrap their brains around that, you're likely going to hear about a new COVID vaccine every year. Every year, because COVID is a virus that changes its face so often. So,
and there are some vaccines that you don't have to get every year.
Absolutely.
Because the bacteria and the virus is not changing. So, for example, your measles, mumps, and rubella vaccine, we typically give that at 1 and 4 years of age, and you're done. Right? Your chickenpox vaccine, we give at 1, 4 years of age, and you're done.
Absolutely.
Your polio vaccine, we start as early as 2, 4, 6 months, and you get a booster at between 4 and 6, and you're done. So we know certain vaccines you don't have to get every year because we know how these disease processes work. And we also implore you to talk to your doctor.
Absolutely.
Because not everyone is eligible to get a vaccine. So please talk to your doctor to find out you're eligible for vaccines that are being recommended because of your age.
Absolutely. Most important thing as you listen to this podcast, make sure that you recognize that your doctor is your greatest source is a great source of information for you, and make sure that you please talk to them so they can specifically give you advice
on you, because your doctor knows you personally. Your doctor knows your medical history. Your doctor knows the medications you're taking. Your doctor knows your family history. So it's important that any information that you receive, you're taking it back to your doctor to determine what is appropriate for you and your children.
So, Dr. McDonald, I want to ask you a question in regards to vaccines that comes up often. So if a child comes to your office and they're new to your office and they don't have any vaccine records.
Yes.
Can you explain how you can determine if that child has actually been vaccinated in the past or not?
So you can draw what we call titers. You can draw their blood work and you can see how their immune system has responded to the vaccine. So if the titers are below a certain number, their results below a certain number, we know that that child needs to be vaccinated against that particular disease. So yes, we can draw blood to determine if the child needs the vaccine or not.
And also, Dr. McDonald, if a child needs multiple vaccines, because many vaccines it's a multiple series. It requires more than one vaccine.
Almost all vaccines come in a series.
And so if a patient comes in and say, for instance, they were getting their hepatitis vaccine and they would get the first one and then the other one a month later, and then another one 6 months later.
Yeah, hepatitis D vaccine. Yeah.
Absolutely. So what would happen if the child got their first vaccine and then missed their second vaccine and then can then come back for 2 years? Do you have to restart the series?
No. So most vaccines do not have to restart the series. Certain vaccines are time sensitive. For example, the rotavirus vaccine is time sensitive. If you do not complete that vaccine within a certain period of time, you cannot start it or finish it later. But the majority of vaccines, as you mentioned, the hepatitis B vaccine, if you got 2 vaccines, then you came back a year later, I'm going to give you the third vaccine, and you are considered up to date.
Absolutely. Now, the other thing is, you can't vaccinate too early either, right, Dr. McDonald?
Cannot vaccinate too early. Because if you vaccinate too early, then the vaccine will be considered invalid. And later on, the child will have to be revaccinated again. So there are specific rules for giving vaccinations, and they're all based on studies that have been done. Again, we're doctors, we're scientists. Any information that we're giving has been based on studies and data that's out there. So we have to follow certain rules for giving vaccines. We have to make sure that they're spaced out between, certain time intervals. You want to make sure you're not giving them too early, to make sure that the vaccine has the opportunity to boost the immune system in the most effective way.
Absolutely. Now, many times, and I just want to talk about the flu vaccine. So I talk to many people on a regular basis, and I say, hey, do you want the flu vaccine? And some people said, no, because I don't want to catch the flu. Can you speak to that? So, Dr. Wardlaw? Yes, absolutely. When we administer the flu vaccine, you are not able to contract the flu virus from
Not from the flu
vaccine.
Not from the flu shot.
Not from the flu vaccine itself. Now, you may feel like you are under the weather. You may have some muscle aches. You may have low-grade fever.
Runny nose.
You may have a headache, soreness at the injection site. But I promise you, you will not get the flu from the flu vaccine. So I encourage people to, again, have a conversation, make sure that you're getting the pertinent information that you need. And no, you cannot and will not get the flu from the flu vaccine.
From the flu shot.
You will not get COVID from the COVID vaccine.
Yes.
So just want to make sure that people are aware of that.
Yes.
And if you do develop those side effects, most of the times, many people can take Tylenol or Motrin if it's safe for them to take those medications to help with those side effects. But yes,
you now talking to your doctor to figure out what is the best way for you to treat your symptoms.
Absolutely. And let's not forget, there are required vaccines for school.
Absolutely. Because it becomes a public health issue. So there are certain vaccines that are absolutely required for school. You can find them on the websites, the school district websites, to let you know which vaccines are required. Because again, many of these diseases are spread, they're airborne. They're spread through coughing, they're spread through sneezing. So we want to make sure that we're protecting all of our children. And one of the best ways to do that is if you are opting to send your child into a school environment, we need to protect every child, and vaccines is the best way to protect these children.
Absolutely. You also need your college student will also need some vaccines as well. So again, make sure that you are aware and making sure that your child is not running the risk of not being able to go to school or attend their college classes because they have not received the appropriate vaccine that's recommended for school.
And just remember, they have gone through rigorous trials. They are safe. They are effective. And we have seen them work. Whether or not we recognize it or not, vaccines are significantly important in decreasing the spread of deadly disease.
Absolutely. And we have seen some side effects. And, we have seen we saw side effects with the COVID vaccine as well, which I do think that the CDC was very transparent.
Yes.
They put those side effects on their website, whether it was the case of blood clots that was associated with the Johnson & Johnson vaccine, which is no longer available in this country, whether it is myocarditis, which we saw was affecting young males with the COVID vaccine. We do know that there is a rare chance of one developing Guillain-Barré syndrome. So we do know that there are some complications and some side effects. But again, I think that the CDC has been very transparent and making that information readily available.
Yes. And again, we always talk about the possibility of side effects and the likelihood of side effects. So you always have to compare the benefit versus the risk.
Absolutely. So with that, I would like to remind you that when you're receiving information, please make sure that it is a credible source that you have received the information from. Please make sure that we are not participating in the
spread of misinformation
through text, social media, things of that nature. And again, making sure if you have a question or concern, you check with credible resources, your doctor, checking with the CDC, checking with your pharmacist, checking with the NIH, the National Institutes of Health, checking with and Philadelphia here, we are blessed to have a multitude of hospitals and medical centers, whether it's Temple University, University of Pennsylvania, Jefferson University, Albert Einstein University. So again, making sure that you use a trusted source and not relying on Google, TikTok, social media as your only source of information. So with that, we thank you for tuning in, and we ask you to tune in for our next episode, which we will be focusing on what you eat, because you are what you eat, and how it can affect your health and also physical activity. So you have to keep moving as well. So stay tuned and join us for our next episode. I didn't see a time. I saw. Oh, I saw some time. I saw.